Hello, and welcome to the Innovation Forum AI podcast, a space where we explore how artificial intelligence is transforming public health. Are you curious how artificial intelligence can actually make your public health work easier and smarter? In this episode, I speak with Dr. Kene David Nwosu from the University of Geneva and the Graph courses about how AI is reshaping public health, from better data use to smarter, more ethical decision-making. Hi, welcome everybody. My name is Oliver Morgan, and today I'm talking with Kene David Nwosu, an epidemiologist and data scientist at the University of Geneva's Institute for Global Health. Kene is also co-founder of the Graph courses, a non-profit education platform providing accessible training in data science for AI for the health and life sciences. So welcome, Kene. How are you doing today?
Thank you for welcoming me. I'm doing well, and I'm sort of happy to be one of the first guests of this effort you're making. I think it's really important, very useful. Lots of folks in our space are understandably a bit worried, excited, a mix of both about the coming wave of AI and ML tools in this space. And so I think the work you're doing is super valuable, and I'm happy to be part of the journey.
Great. Yeah, thanks so much, Kenny. We were chatting just before we started recording the episode about that we actually met because I took one of your courses. At the beginning of this year, I did your course on generative AI for public health and research. And it was such a great course and really inspired me to kind of stretch myself a little bit in terms of learning about different aspects of AI. I think maybe I would classify myself as a kind of keen amateur of kind of AI use, but I think through the course, it really helped me, start engaging in a bit more of a structured way. We'll talk a bit about the course later on, and it'd be good to explain to some of the listeners about how you and your team and colleagues are teaching AI and getting others involved in AI. But I thought it would be really helpful if we could maybe just start with you explaining a little bit about what AI is and how it's come about, and what is an easy way for us to kind of first get engaged with AI.
Yes, so indeed, that is how we met, as you were a student in my course, and we're very excited to have you, and hopefully we can talk a bit more about that later on. But in terms of getting started with AI, I like to think of a number of sort of simple use cases, ways in which most people are already familiar with AI. One of those is just weather forecasting. And so what is a weather forecast is basically an artificially intelligent model that takes in some input data, and that input data is maybe how much sunlight is there, did it rain yesterday, how much cloud cover is there, the humidity, and tries to output some prediction based on that. Is it going to rain at a specific time? And the most important part of that is that to create the model, you need to do a lot of what's called training. You need to train the model, and the training of the model looks like getting a bunch of iterations or examples of historical data, historical examples of that input, and the corresponding output. So maybe a year ago, when we had this list of conditions, did it rain or not? And repeating that several hundreds, thousands, millions of times. And so you basically go from some input data to some output prediction. And that is sort of classical ML or classical machine learning. And we now have the sort of more modern examples of AI, basically large language models. And those have taken the same idea of taking some input data and making an output prediction, but have applied it to a very specific use case, which is you take the input data as just text that's available on the internet, and then you try to train the model to predict the very next word that comes from that text. And it turns out that if you scale this training procedure over millions of training examples and really millions of dollars as well in terms of compute, then you get out models that actually start to seemingly understand human language and understand all the kind of knowledge that is that is built into this human language. So in order to predict the next thing that comes in a block of text, you need to kind of learn how a human thinks. And these models indeed are learning how humans think and are doing all the very impressive things that we see models like ChatGPT and so on do. And so that's the general pattern for AI is you need some training data, some input, and then you teach a model that's a computer algorithm to give out some output. And you have very many variations of this. And the most exciting, maybe modern incarnation are these large language models that everyone is now familiar with.
Yeah, I mean, I've heard people describing AI as really sophisticated pattern recognition or prediction kind of algorithms, and we've seen, a lot of these AI models really improving very, very rapidly. It feels almost like every 3 months or so, there's a new almost kind of revolution in these AI models. I mean, how are they driving this pace of change and development? I mean, it seems almost astonishing, if you think back to, 18 months ago with the release of, was it ChatGPT 3, which made the headlines, and it was a fairly, I would say, a basic type of experience at the beginning, but somehow it's like accelerated. I mean, how is that actually happening?
Yeah, so indeed, many people describe AI as fancy statistical pattern matching, or even people also call them stochastic parrots, the large language models. And this is indeed the case. It is just fancy statistical pattern matching. But it turns out that is how humans learn as well. We do very complicated statistical pattern matching. And a lot of the folks developing the algorithms behind these AI models take inspiration indeed from human learning or from sort of animal learning in general. The term neural network refers to the sort of training algorithm or training regime that's used to train things like large language models. And the neural there refers to a neuron, a human neuron or an animal neuron. And then to the question of what is driving the sort of scary progress that we have been seeing over the past few years, there are a few different categories, and maybe we could split them into the training data and the training compute. And maybe we could also talk a bit about the algorithms as well. In terms of training data, we've seen a very large increase in the amount of input data being used to train these models. So, for example, the GPT models, which have made a huge splash across the internet or across the world, are trained basically on all available internet text. So all of Wikipedia, all of open source GitHub, almost every single crawlable page on the internet has gone into training these models. Okay, and we're discovering new ways every few months to get new data. Many companies now are getting YouTube transcript data, transcribing that and turning that into stuff to feed into these models to help them learn how humans think. So that's the data angle. And then the compute angle is just basically how many sort of, you can think of it as training iterations or training runs can you do. And this has also been increasing exponentially, driven by sort of better and better chips, smaller chips, cheaper chips. At the moment, the most valuable company in the world, I believe, is NVIDIA. And what does NVIDIA do? They just make these chips that train these models. And so because they're so useful, these AIs that we're building, then there's so much investment going into making better, faster, cheaper of these chips, basically the compute that's going into the models. And then lastly, there have been a few innovations in terms of the algorithm that's going into training those. But most of it is really more data, more compute, and you just pour that in and you build this evolutionary process where you keep getting better and better models. And later we can talk about what are possible limits to that. Is it ever going to plateau?
I mean, it was actually one of the things I was thinking when you were talking was about the limitations of data, because in the health domain, certainly in the public health domain, we're dealing with often quite dirty, disorganized data or incomplete data. And it's quite difficult to pull all of that together. So presumably the quantity and quality of data, certainly for health and public health, might become a limit, or maybe is already becoming a limit in how we train these models. And I guess if that is the case, then maybe that points us in the direction of where we can possibly contribute to creating better models in the future.
Yeah, so the point of issues with data is very valid, especially in the health domain. And so one thing you talked about is dirty data. Well, one benefit actually of the large language models is that they learn very well from very messy, unstructured data. So before, if you wanted to train a model, you would typically need some very structured tabular data. Maybe you're trying to train a model to predict HIV risk. You need to have for every patient or for most patients, maybe their demographic information, social information, biological information, and so on, and trying to predict their HIV risk based on that. And you need this very neat, structured data. But now you sort of just throw a bunch of basically you throw the internet at these models and they start to learn. But of course, the internet is not necessarily accurate. So the models are learning both from accurate information, but also from some inaccurate discussions on a Reddit forum. And so knowing how to knowing how to verify when the model is going into the part of the latent space that is correct versus the part that is incorrect is something that's a skill that needs to be learned. And there's a lot of biased data as well on the internet. And so there have been studies showing, for example, that if you try to use these AIs like ChatGPT to do things like triage or maybe to make employment decisions outside of the health domain, they often end up with these tiny biases that are hard to train out of the model. And then another thing is just invisible data. So I talked about how these models are trained on data that's available. Well, a lot of data is still stuck in sort of written documents that hasn't been made accessible for training health models, or it's stuck in sort of private healthcare data repositories that isn't accessible to researchers or to companies to train, and in a way that's good, that's important for keeping our healthcare information private. There are things called federated learning, where you can actually train a model on private data in each repository, in different repositories. And all of that training is kind of being imbued into the weights of the model without the data leaving each of those warehouses. And that's a fairly promising thing over the coming years for training healthcare models.
So, I mean, would it be possible then to use private data or personal identifiable data to help train a model, develop model weights, but then essentially remove the data from the environment and just remain with the weights, and then use that for your AI models? Is that what they do, or does the data remain somehow within the model and be, is it discoverable somehow?
The thing I was talking about with federated learning is more about without taking the data from its private silos. Training on that data, training a larger model on a bunch of small silos of data without the data leaving each of those silos. But the question you're talking about is a bit more difficult, and that is, if you train it on this data, even if it's siloed, that data may have personal information or things that are sensitive that shouldn't go into any model. And there's a question of, can we stop the model from learning the sensitive bits? And if the model learns the sensitive bits, can we then train it out of the model? I think there's not that much progress on that latter thing of training, getting those weights out of the model, because the weights are very inscrutable. We don't really understand what's going on in those weights. There's a lot of work being done on what's called model interpretability, but it's very, very early days. And so where there is maybe more of more hope is on just not allowing that data to go into the training regime in the first place. And model providers, model trainers have decent ways of de-identifying data before it goes in. The most common, of course, is just remove sensitive identifying information, but that's not always very accurate or very effective. There are other ways where, based on how you mix the different data, you lose the connections between the sort of sensitive identifiers, and a number of other techniques like that. But in terms of training it out of models that have learned it, I think that's still quite difficult.
So, I mean, so really, in terms of training these models for health purposes in particular, or public health purposes, it sounds like there needs to be an additional step, which is really creating either synthetic sets of data or de-identified sets of data, which we can use for the models to learn on. I'm guessing that that's going to require a whole lot of extra efforts to, create those kinds of data sets for health purposes in particular.
Yes. So indeed, two things you mentioned there are very key steps in terms of getting health data accessible for training useful AI models. And like you said, that's de-identifying the data and also creating synthetic data sets. So we've talked a bit about de-identification. One additional thing I'll mention there is that you can actually have small AI models which are running kind of on computer or on your own premises, do that de-identification for you. And those small models don't have any privacy risks because, again, they're running on your own infrastructure. The sorts of big models that we use maybe with ChatGPT or with Gemini and so on are usually a bit too heavy to run on local infrastructure. Okay, but we can use these small models to do that de-identification. And we could also use these models to do the generation of synthetic data as well. And then on the topic of synthetic data, maybe another thing that I could mention is that maybe I'll just mention this. It's still kind of early days for creating synthetic data. The reasoning models that most of us now use, when I say reasoning, I mean the models where they start to, before they give you the final answer, they show you the steps of how they got to that answer. And they have this sort of reasoning trace. Some of the model providers hide that. Others will actually show you the reasoning trace. But a lot of those reasoning traces were created using synthetic data. That is, a model is asked a question, and then it is prompted to give us a reasoning trace and then get to a final answer. And then you train on the reasoning traces that got you to the right answer and train against the reasoning traces that got you to the wrong answer. So that's one example of where synthetic data is already having a huge improvement on, a huge effect on model training.
I mean, there was something that you mentioned which kind of sparked a question in my mind, which was the idea of using one AI model to, let's say, prepare some data and then feed that into another AI model to train it. So does that mean we're now in a scenario where we're actually talking about an ecosystem of AI models rather than a single AI model as it's kind of presented to us, I guess, in the marketing sense, where we talk about ChatGPT or Claude or Gemini, and it gives at least the perception that it's a single model. But actually, it sounds like we're now in a world where there's a whole range of different models working together, creating this kind of ecosystem that kind of interacts with each other and doing maybe some highly specialized tasks. Is that the reality today?
Yes, I would say today they are, even for most of the kind of standard LLM providers, under the hood, they have several models. So let's take ChatGPT's GPT-5. So there was a lot of fanfare. There was a lot of excitement before GPT-5 was released, and then maybe a dip in enthusiasm because it didn't turn out in some ways so amazing. One of the reasons that people didn't love it was because they basically built in a model router into ChatGPT 5, and that tries to figure out, based on your query, what complexity of model should we have answer it. Again, it routes you to either the sort of quicker, less intelligent model or the more intelligent but slower model. And many people get upset because they get the less intelligent model and their answer is silly. And so that's an example of the move we're having towards kind of a more models rather than a single large model. And then maybe rewinding a bit to the question of using one model to create training data for another model. In that case, what we're using the first model to do is not, we can't really create that data out of thin air. What we're using it to do is de-identify data or reshuffle data, do some manipulation on the data to make that data, in this case, less sensitive for the larger model to actually train on. And so some people have this worry that we're going to get a regime where models will be training models and all of this will just go on without any actual interaction with the real world. There are people who worry that we're going to get to a singularity because of that. I'm skeptical. I think you end up needing actual data that needs to be collected, often by humans in the real world. You need actual experimental outcome data as well to actually drive the progress in these models. So I don't think you ever get a regime where models are improving models without actually interacting with the world.
Great. Well, as an epidemiologist, I'm delighted to hear that there's still a role for collecting data, primary data. I think that's an important take home for all of us, that we're not going to just be replaced by endless AI models, but we have an important role to play. I mean, how are these models now being used in various different healthcare or public health use cases? I mean, what kind of things are people now doing with these models?
Yeah, so in terms of how AI is being used currently in healthcare and in public health, we could divide into maybe the more traditional kinds of machine learning and then kind of the new wave of large language models. And in terms of the traditional kind, the most common use case, a lot of what the work I've done, for example, in my work as a data analyst, is just classification and prediction of outcomes. So as an example, maybe you have a population. So there's a study being done with my team at Olivia Kaiser's group at the University of Geneva, where they used data from DHS, that is socio-demographic data, to predict people's likeliness of having HIV. That's high or low risk of HIV. And this is used very widely. This kind of model is used very widely in public health. Is you have some input data, often socio-demographic. You're trying to predict, is this a high or low risk of HIV, high or low risk of COVID-19, and so on. And this is widely deployed and well known about. Another widely deployed type of model are these computer vision models. So used for things like radiology or dermatology, often as a kind of first pass before an actual radiologist looks at the data or a dermatologist looks at the image. And so you have these computer vision models widely deployed. And then in terms of the kind of new wave of these large language models, it's still quite early days. And there is a lot of skepticism still in the medical and health field about using these. I would say two use cases I know that are working are just summarizing kind of doctor notes into the actual kind of structured formats that people need, doctor notes, nurse notes, and so on. So as many of you know, usually during your consultation with a health professional, they need to write down a number of things. They write it down in their sort of chicken scratch handwriting often. And then it's the job of a medical scribe, or sometimes even the doctor themselves, to put this into a structured format that the EHR will like. Well, LLMs are really quite good at this kind of reformatting. Sometimes they have hallucination issues, but in terms of taking an existing body of text and just putting it in a slightly different format, they're really almost better than humans at that task. And so that's one place where most people are very happy to basically have this keyboard liberation. Another one maybe is in terms of education. So educating of people in public health. Like I said, models are very good at reformatting information. So taking things from boring lecture notes to dynamic, interactive documents, even videos, quizzes, things of that sort.
Notebook LM,
education for the public,
like the Notebook LM type things, yeah. Mm-hmm.
Yeah, education for the public as well. So not just for health practitioners, but for public consumption. Maybe those are a few places where I think the current wave of LLMs are already being used quite well. But they are, in theory, they could be used for a very wide range of things. It's just a question of how do we roll them out in a way where they're not opaque, so we understand what they're doing, and it's actually taken well both by the medical community and by the public as well.
Yeah, I mean, there seem to be huge opportunities to certainly reduce administrative burden, right? And as you said, I think this is now increasingly common that during a medical consult, the doctor will, either be able to dictate the notes or, just write them down and hand them off to basically an AI model that can transcribe them, classify them, store them and make them usable for the future. So I see there's a huge opportunity, and I guess in all of our lives, we're using these technologies more and more, whether it's just to summarize and transcribe meeting notes that we have and do kind of action items, or medical records, transcriptions. I think it's super useful. So it's probably already with us in many instances, and I think it's probably going to get pretty pervasive over the coming years. I mean, in terms of, so I mean, just to kind of come back to something I mentioned at the beginning of our conversation, which was the course that I took and the teaching that you do through the Graph Network. It'd be really interesting to hear about how you're thinking, and you and your team are thinking about training public health professionals in the use of AI. What kind of things do people, want to learn about? What do they need to learn about? And I mean, how are you guys going about upskilling the likes of myself and my colleagues in AI?
Okay, so in terms of traditional machine learning, there used to be a kind of dichotomy in the public health space between people who are doing the data analysis and epi and the actual practitioners. And I historically have been on the data analysis side. And the idea was people who are actually practicing don't need to understand too much of that machine learning stuff. Maybe they just need to understand the output of the machine learning model and a little bit of how to explain it to people who may ask questions about how these models are working. But now we're moving into this world with modern AI, with large language models and the multimodal models, where these things are touching kind of all aspects of knowledge work and therefore all aspects of the sort of public health domain. And so just as maybe 15 years ago, everyone in the public health space was needing to develop basic computer literacy, or maybe more than 15, maybe 30 years ago, in order to continue doing good public health. And now you're going to need to have some basic AI literacy, because these things are going to infuse themselves over the next decade into all parts of our work. Okay, and so what we're trying to do with our course and with Graph courses in general is build this basic AI literacy into folks in the healthcare domain and in the health space. And that looks like a few things. One of those is teaching a little bit about the foundations of these models, a little bit about how they work. When you understand, for example, the idea behind next token prediction and how that is behind all of large language models, then things like hallucinations when the model kind of gets the wrong answer don't seem that surprising anymore. It's kind of obvious why the model would hallucinate, and it's therefore obvious you should always not trust the initial output of the model, but rather verify and make sure it's actually correct. Also giving them a little bit of engagement with the wide range of tools. So there's just an explosion of current tools being used in different little pockets of work, and giving folks exposure to that, teaching them those use cases, brainstorming amongst each other. So that's going to be a big one. It's a kind of a new space. There's a flourishing of tools, and we need to brainstorm about what are the best ways, what are the ethical ways to use all of these, and maybe finally kind of helping people not be scared. So because there are these issues with these LLMs around hallucination, around bias, there's issues as well about how these LLMs were trained, ethical issues. Lots of people, lots of fields are a bit worried to embrace these. And getting past that fear, I think once you have some understanding, then the fear starts to kind of fall away, because these things really can improve your efficiency, not only for back office operations like we talked about, for education, but also increasingly actually for the kind of more, let's say, bottlenecked areas of actual diagnosis or actually talking to patients. There are actually use cases for these models in that domain, although it's going to be a sort of gentle and it's going to have to be a careful transition into such a regime.
Yeah, I mean, I found the course really fascinating. I guess, like many, practitioners in public health or in the health space, I was pretty lost to know where to start in terms of like my own learning journey. I, was looking at YouTube things and looking at various other kind of courses, trying to do self-directed learning, and that's kind of difficult because there's just so much out there. I think having a bit of structure to the learning is super helpful, and I got a lot out of that. One of the things that I also discovered, or maybe rediscovered, is like probably like a lot of people who will be listening to this podcast is that, at some point earlier on in my career, I did a reasonable amount of coding and worked with statistical software where you had to write in commands. But I haven't done that for quite a long time. And one of the things that we did in the course was actually use AI to help write code. In this case, I did quite a lot with Python code during the course. And I found that super enjoyable. And actually that's led me to like do a little bit more coding in my own time, which I think I would never have done without these AI tools. So it seems to really be, opening up a range of options for all sorts of people to be able to write their own code.
Yes, so that's a very important point. Is often people talk about skill degradation that may happen when you use these AIs. That is, you start to rely on them for things that you would normally have been doing, and your skills slowly kind of fall away. And that is true to some extent, but the counterpoint to that is that there are many skills that you have a sort of basic level, or maybe that have degraded in the past, but because you have this somewhat all-knowing kind of agent that you can reach out to, you're actually able to kind of multiply your reach. And so I think of it kind of like maybe a calculator, which is if you know the basics of arithmetic or mathematics, then a calculator really allows you to expand the kinds of things you can do. Or maybe an Excel spreadsheet as another example. And so for folks in the health domain who maybe took one SPSS or one EpiInfo class during their education and have fallen away from that, if you understand the basics, and importantly, you know sort of how to check for model hallucinations, how to verify the model's output, then you can really kind of get back into coding, get back into data analysis. We know that a lot of health data is sort of waiting to be analyzed, is stuck, like we know, in these silos. And the people with the access to that data don't often have the skills or the sort of guidance to do this analysis. But like we're just saying, with just a little bit of knowledge plus a little bit of AI assistance, you can now do a lot of work that wasn't quite possible before. So as a complement to skill degradation, we have this sort of skill exponentiation in a way. That I think is very worth noticing.
Yeah, I mean, I thought that was a super kind of interesting insight. I mean, it definitely has, I guess, encouraged me to kind of get back engaged with all sorts of data analysis, which I used to do, and for various reasons haven't done a lot of in the last few years. And like a lot of people, I guess, I kind of migrated into a more management type of role. But these tools are really fantastic, and they're not perfect, as you say. I mean, I remember, I think a number of examples where it produced output that was clearly, like wrong, just plain wrong. But you have to, and if you keep checking it, you can fix it fairly easily. So yeah, I think it's really opening up a whole range of different opportunities for people, and I think that's a really exciting message as well. The other thing I hear, kind of from various commentators, is that like kind of don't wait for a kind of equilibrium or a kind of status quo to kind of settle down in this kind of AI space before getting engaged, because it's probably going to carry on changing and evolving very rapidly for the foreseeable future. And the longer you wait to get engaged, the kind of almost the further behind you get, and it gets harder and harder to catch up. I mean, do you agree with that notion? Should people just jump in straight away and get going and not worry about, the fact that a tool they learn today might be obsolete in 12 months' time?
Yes, I wholeheartedly agree. And this is something that we had to deal with as creators of educational content. One thing with creating educational content is you would prefer if the state of knowledge stayed the same for the foreseeable future. So you don't have to go remake your syllabus, remake your videos, and so on. But what we saw and what we predict is that really over the coming decade, these things are going to keep shifting. And the final state was not going to be known for a while. And so you need to kind of get started early. And maybe a few things I'll say about getting started early. One is that if you get started early using the kind of inchoate, maybe early forms of the tools, that helps you better understand the tools when they get advanced. So something I talked about, like understanding hallucinations. So because I have played with the earlier versions of these models, GPT-2, GPT-3, where it's very clear what they're doing in terms of next token prediction, then it's easier for me to understand the sort of edge cases, the last mile problems that some of the more advanced models are dealing with. So actually starting early gives you the basics, the foundations to understand later systems. And indeed, just like you have said, the pace of improvement is going to be sustained over at least the coming few years. And so starting early is good. And you won't regret having started early.
I mean, it's. I was thinking about that throughout the course. Was that some of the bits of software that we are using, might be replaced in the next coming months, but understanding and skills remain. And I think there is, as you mentioned, there's a kind of a little bit of a fear factor or a barrier to kind of getting engaged because there's a lot you don't know. But I guess the more you expose yourself to some of these AI tools, the more familiar they get, and it's easier to learn the next one as it comes along. I mean, as of kind of some concluding thoughts, I mean, thinking about the future and where all of this is heading, where do you think we might be in, next 2, maybe 3 years? And, as, health practitioners or public health practitioners, what will the world look like? What will our kind of toolkit look like in the next 3 to 5 years? I mean, what's coming up at us?
Well, it's hard to predict the future, especially in the world of AI. So maybe I'll start by saying that. But maybe one area that I think we haven't seen that much progress in yet, but is coming, is having AI tools actually involved directly in the sort of clinical diagnosis and sort of treatment areas of the healthcare continuum. And we've seen, for example, that these models are very good at answering medical type questions. So they're doing almost perfect scores, for example, on the USMLE, the United States Medical Licensing Examination, better than humans. But because we know that there's sort of a bunch of edge cases, a bunch of hallucination problems, and there's general fear of these models or a concern, then they haven't been properly integrated into the continuum of care. And I think over the next few years, that's going to start to happen. Parts of it will be scary, and there will be a few missteps here and there. But many of us are already kind of using ChatGPT as our second opinion after we've gone to a doctor, or now increasingly as our first opinion, and then we go to a doctor with all of our claims. And I think the healthcare community is going to start to have to reckon with that, so that people are trusting these models. And so how can we bring in a sort of guarded, ethical, safe way, bring these into our sort of pipeline, maybe as triage agents, so that they do a first pass before an actual public health or healthcare practitioner looks at the data. And so I think we're going to slowly move into that world. But I think that it's going to be empowering, not disempowering. So I mentioned at the top maybe that my area of work is data analysis. So I don't have as much experience as maybe some of the other guests may in terms of actual healthcare. But in the space of data analysis, programming, machine learning, I initially had this fear that AI tools were going to completely displace the kinds of work that people like me are doing. But as the years have passed on now, I'm seeing that's not quite shaping up to be the case. Is rather they're enhancing existing capacity, and you still need the humans to steer the models in the right way. And I think that's going to be the case in healthcare in general as well. There's a lot of sort of societal, personal context, patient context that the models really are just never going to have. And so the sort of humans in the loop are going to need to be guides, making sure that the models stay on track. And I think that's really a future that's coming fast. And it's going to be a bit scary, but I think that the overall outcome will be better healthcare, better public health across a range of communities.
Yeah, well, that's great. I mean, I think, as you say, we're on this journey. We're not going to go back, and I think these tools are going to just continue to evolve. For those listeners who want to get engaged and learn more, what are some of the resources that you think they might turn towards? And maybe you can wrap us up with just some reflections about the course that you teach, and some kind of insights that you've gained from interacting with lots of students like myself, people who are in the public health space who are keen to learn more about AI and how we can go about doing that.
Maybe I'll start with the first thing you mentioned, which is resources. What sorts of resources? There are a few documents that in my kind of prep I stumbled on. One of those is actually WHO put out a recent guides document, about 60 pages or so, of the current thinking around using large language models. And it's quite rich in terms of ideas for implementation, but also in terms of listing the issues, the risks that you may run into using these models. And so that's highly recommended. The US CDC also has now a kind of database of about 400 or so example use cases of multimodal and large language models across a range of domains in the CDC space. And that's also a good resource I'd recommend. And these are important because we're in early days. We're kind of at the beginning of the computer revolution, as an example. Folks don't yet have a clear sense of how these tools may be applied to their domains. And so seeing examples from other folks is quite helpful for brainstorming. And maybe that's a nice transition to our course, because one of the things we hope to do with our course is bring together folks that are in this kind of health and life sciences domain to co-brainstorm, because we don't have all the answers about how to use these models and how to steer them correctly. But if you have a community of folks brainstorming together, then you're more likely to really stumble on the right use cases where the models, the model strengths are actually used, and the model weaknesses are very well curtailed. And so that's one of the things we try to do with our course. And I would say so far it's been fairly, it's early days. We've run only a few cohorts, but we've had good feedback from students. And we hope to run a survey probably next year, looking at past alumni, looking at some ways that they are now actually using these tools, whether productively or whether they found them to be actually not helping much of their work.
Great. Well, we'll put the links into the notes as well with this episode. But for those of our listeners who haven't got access to the notes, quickly, what's the website address for people who want to learn more about your course?
So our address is thegraphcourses.org. thegraphcourses.org.
Well, thanks so much, Kene, and all the very best with your future endeavors. And it'll be great to have you back sometime in the future to hear how things develop.
Yes, by then lots of things will have changed.
Undoubtedly.
And yes, I'll be happy to be back.
Great. Well, thank you so much. Bye.
Thank you.
Thanks so much for joining us for this episode. We hope you enjoyed it as much as we enjoyed making it. Be sure to subscribe and share this podcast with your friends and colleagues. We'll see you next time.
The Innovation Forum AI podcast is produced by Zoila Leiva Rioja and brought to you by the WHO Hub for Pandemic and Epidemic Intelligence. We'd love to hear your feedback and ideas. Reach us at pandemichub@who.int.